1. A 45-year-old patient presents with chronic low back pain. Upon physical examination, you note decreased range of motion and tissue texture changes at L3, L4. Which osteopathic principle is most directly applied when treating this somatic dysfunction? A. The body is a unit. The person is a unit of body, mind, and spirit. B. Structure and function are reciprocally interrelated. C. The body possesses self-regulatory mechanisms. D. Rational treatment is based upon an understanding of these principles. 2. During a primary care visit, a 28-year-old female complains of recurring headaches. Structural examination reveals cervical spine restrictions at C2, C3. What is the most appropriate initial osteopathic manipulative treatment approach? A. High-velocity, low-amplitude HVLA thrust technique. B. Muscle energy technique. C. Counterstrain technique. Cranial osteopathy. 3. A patient presents with acute asthma exacerbation. According to osteopathic philosophy, which rib dysfunction would most likely contribute to compromised respiratory function? A. Rib 1 exhalation dysfunction. B. Rib 5 inhalation dysfunction. C. Rib 10 exhalation dysfunction. D. Rib 12 inhalation dysfunction. 4. In osteopathic structural diagnosis, what does the term ease refer to when assessing tissue texture? A. The direction of greatest restriction. B. The direction of freest motion. C. The neutral position of a joint. D. The position of maximal pain. 5. A 60-year-old diabetic patient has developed gastroparesis. Which osteopathic Chapman's reflex point would be most relevant for treatment consideration? A. Anterior 5th intercostal space near sternum. B. Anterior 7th intercostal space near sternum. C. Posterior tip of 12th rib. D. Anterior superior iliac spine. 6. When performing a screening examination for somatic dysfunction, what does TART stand for? A. Tissue texture, asymmetry, range of motion, tenderness. B. Temperature, alignment, restriction, tissue. C. Tension, atrophy, rotation, tenderness. Texture, adhesion, reduction, temperature. A medical student asks about the mechanism of muscle energy technique. What is the primary physiologic principle underlying this treatment? A. Gait control theory of pain. Post-isometric relaxation, C. Viscoelastic creep. Decavitation phenomenon. 8. A 35-year-old patient has been diagnosed with pneumonia affecting the right lower lobe. Which thoracic vertebral level would most likely demonstrate viscerosomatic reflex changes? T1, T4, B, T5, T9, C, T9, T10, D, T11, T12. 9. In counterstrain technique, how long should the tender point be held in the position of ease? A. 30 seconds. B. 60 seconds. C. 90 seconds. 120 seconds. 10. A medical student asks about the mechanism of the autonomic nervous system's role in osteopathic medicine. Which statement is most accurate regarding sympathetic outflow? A. Originates from cranial and sacral regions. B. Originates from thoracolumbar region T1, L2. C. Originates uniformly throughout the entire spinal column. D. Has no specific spinal level association. 11. During osteopathic cranial examination, you assess the cranial rhythmic impulse. What is the normal rate of the CRI in cycles per minute? 4-6, B 6-12, C 10-14, D 12-20. 12. A 50-year-old construction worker presents with right shoulder pain. Examination reveals a type 2 somatic dysfunction at T4. What does type 2 indicate? A. Neutral mechanics with rotation and side bending to opposite sides. B. Non-neutral mechanics with rotation and side bending to the same side. C. Flexion dysfunction only. D. Extension dysfunction only. 13. When treating a patient with lymphatic congestion, which osteopathic technique is most specifically designed to enhance lymphatic flow? A. Thoracic inlet release. B. Pedal pump technique. C. Balanced ligamentous tension. D. Facilitated positional release. 14. A 32-year-old pregnant patient in her third trimester complains of sacral pain. Which osteopathic technique is generally contraindicated during pregnancy? A. Muscle energy technique. Myofascial release. C. High-velocity low-amplitude thrust. D. Counterstrain. 15. In osteopathic philosophy, what is the rule of the artery? A. Arterial disease causes most chronic conditions. B. Unrestricted arterial flow is essential for health. C. The carotid artery must be examined in all patients. D. Arterial palpation determines treatment approach. 16. A patient has chronic constipation. Which osteopathic manipulative treatment would address the parasympathetic innervation to the descending colon? A. Treatment of T10L2. B. Treatment of cranial base. C. Treatment of sacrum. Both B and C. 17. When diagnosing a sacral torsion, what landmark combination is used to determine the axis of rotation? A. Sacral sulci and inferior lateral angles, ILA. B. Posterior superior iliac spines and sacral base. Apex. D. Iliac crests and L5 transverse processes. 18. A patient presents with acute otitis media. According to osteopathic principles, treatment of which structure would most likely improve eustachian tube drainage? A. Occipitomastoid suture. B. Temporomandibular joint. C. Atlas seam vertebra. D. All of the above. 19. What is the primary difference between direct and indirect osteopathic techniques? A. Direct engages the barrier, indirect moves away from the barrier. Direct uses less force, indirect uses more force. C. Direct treats acute conditions, indirect treats chronic conditions. D. Direct is active, indirect is passive. 20. A 25-year-old athlete presents with a lateral ankle sprain. Using osteopathic assessment, you identify fibular head dysfunction. This is an example of which osteopathic concept? A. Somatic reflex. Somatovisceral reflex. C. Regional interdependence. D. Facilitated segment. 21. In performing high-velocity, low-amplitude HVLA technique, what is the most important factor for patient safety? A. Maximum velocity with high amplitude. B. Appropriate pre-thrust tension and localization. C. Using the heaviest force possible. D. Performing the technique multiple times in succession. 22. A patient with chronic sinusitis asks about osteopathic treatment. Which technique would be most beneficial for enhancing sinus drainage? A. Frontal and maxillary lift. B. Lumbar spine mobilization. C. Sacral decompression. Thoracic outlet release. 23. When assessing for rib dysfunction, what breathing phase should be tested first? Always test inhalation first. B. Always test exhalation first. C. Test the phase that appears most restricted. D. Test both phases simultaneously. 24. A 70-year-old patient with osteoporosis requires osteopathic treatment. Which technique carries the highest risk and should be avoided? A. Myofascial release. B. Balanced ligamentous tension. C. High-velocity, low-amplitude thrust. D. Indirect techniques. 25. In myofascial release technique, what is the therapeutic goal when engaging the fascial barrier? A. Immediate tissue rupture. B. Tissue relaxation and barrier dissolution. C. Muscle strengthening. D. Joint mobilization only. 26. A patient presents with dyspnea and you suspect thoracic inlet restriction. Which anatomical structures form the thoracic inlet? T1, first ribs and manubrium. B. T2, second ribs and clavicles. C. Sternum, clavicles, and scapulae. D. C7, first ribs and sternum. 27. According to Chapman's reflexes, where would you find the anterior reflex point for the heart? A. Second intercostal space near sternum on left. B. Fifth intercostal space near sternum on left. Process. D. Left pectoralis major muscle. 28. What is the primary goal of balanced ligamentous tension (BLT) technique? A. Achieve maximum joint mobilization. B. Find the point of balanced tension and allow inherent forces to resolve dysfunction. C. Strengthen surrounding ligaments. D. Increase range of motion through stretching. 29. When performing Spencer technique for shoulder mobilization, how many stages are typically included? A. 3 stages. 5 stages. C's. D. 10 stages. 30. In osteopathic diagnosis, a positive standing flexion test indicates dysfunction primarily at which location? Lumbar spine. Sacroiliac joint. C. Hip joint. D. Thoracolumbar junction. 31. A 58-year-old man presents to the emergency department with crushing substernal chest pain radiating to his left arm for the past 45 minutes. He appears diaphoretic and anxious. Vital signs: BP 166 95 mm Hg, HR 1 in 10 BPM, RR 22 min. ECG shows ST segment elevation in leads 2, 3, and AVF. Which coronary artery is most likely occluded? A. Left anterior descending artery. B. Right coronary artery. C. Left circumflex artery. Left main coronary artery. 32. A 32-year-old woman presents with a 3-month history of heat intolerance, palpitations, and unintentional 15-pound weight loss. Physical examination reveals exophthalmos, fine tremor of outstretched hands, and a diffusely enlarged non-tender thyroid gland. Laboratory studies show TSH 0.01 mmol and elevated free T4. What is the most likely diagnosis? Atoxic multinodular goiter. Graves' disease. Subacute thyroiditis. Thyroid adenoma. 33. A 45-year-old woman complains of right shoulder pain that worsens with overhead activities. Osteopathic structural examination reveals a positive empty can test and painful arc between 60 to 120 degrees of abduction. Which structure is most likely affected? A. Subscapularis tendon. B. Supraspinatus tendon. C. Infraspinatus tendon. Teres minor tendon.